What is up, YouTube? Dr. Waji here. Today we're continuing with the anatomy of the heart. This is part 2 of the heart valves. If you haven't already checked out my previous video, do give that one a go before you watch this one. Alright, so let's begin. Now here we have a nice coronal section of the heart. In my last video, we talked about 4 heart valves, 2 AV valves and 2 SL valves. The AV valves included the tricuspid and mitral valves. The one on the right was tricuspid and the one on the left was a mitral valve. The SL valves included the pulmonary valve and the aortic valve. In this one, we're going to be talking about the surface anatomy aspects of the heart valves. So let's get into it. Now, we've already discussed the borders of the heart and the surfaces of the heart on this diagram. Now we're going to be talking about the location of the heart valves. So let's start with the AV valves. First up, we have this valve over here. This is the mitral valve. It is present at the level of the 4th costal cartilage behind the sternum. The next AV valve we're going to talk about is the tricuspid valve. This is present at the level of the 4th and the 5th intercostal space behind the sternum. That's it for the AV valves. Next up, we have the semilunar valves. The first semilunar valve we want to talk about is the pulmonic valve. It's present at the level of the 3rd costal cartilage. It is partly located behind the sternum and partly located behind the cartilage. And the final valve we want to talk about is the aortic valve. This is present at the level of the 3rd intercostal space behind the sternum. If either of these valves is malfunctioning, then you might hear an abnormal sound on auscultation called a murmur. In the next diagram, we're going to discuss what are the exact sites for auscultation. So when we're talking about the auscultatory areas, we're always going to talk about areas that are downstream from the valve. For example, here at the level of the 4th costal cartilage, we had the mitral valve. Now, if I want to hear a murmur produced by mitral valve dysfunction, I'm going to have to travel downstream in order to hear the murmur, somewhere over here. This area would be called the mitral area. It is present in the left 5th intercostal space in the midclavicular line. You guys might remember this point as the location for the apex of the heart. The reason why you hear murmurs from the mitral valve the best in this area is because of the way the sound travels. Now, the heart is located something like this inside the thorax, and we know that from the left atrium, the blood is going to flow into the left ventricle towards the apex of the heart. Now, if the mitral valve is diseased and it is causing turbulent flow of blood inside the left ventricle, then once the blood molecules collide with each other, they're going to produce an abnormal sound called a murmur. Now, if flow of blood is in this direction, likewise, the transmission of sound will also be in the direction of the flow of blood, which is towards the apex. Therefore, if the mitral valve is diseased, the murmurs produced by it are going to be best heard in the mitral area. Now, you might be wondering, if blood is flowing in the backward direction in cases of mitral regurgitation, then can't we just auscultate the site over here? Well, no. The reason is that this diagram is in 2D, so you can see the left atrium and left ventricle in this view. However, in reality, the heart is rotated in such a manner that the left atrium is behind the right atrium and the left ventricle is behind the right ventricle. So the mitral valve is buried so deep inside the thoracic cavity that sound would not be transmitted through the chest wall into the stethoscope. Instead, whatever sound is being transmitted in this direction will reach the diaphragm of our stethoscopes and we'll be able to hear the murmur clearly. The same logic applies for the remaining valves. Now here, at the level of the 4th and the 5th intercostal spaces, we had the tricuspid valve. Now blood will flow in this direction, likewise sound will be transmitted in this direction. So this is the site where you want to auscultate for tricuspid murmurs. This is called the tricuspid area. It is in the left parasternal 4th intercostal space. Now keep applying the same logic towards the semilunar valves as well. We had our semilunar valves located somewhere over here. The pulmonary trunk goes out like this. Therefore, our pulmonary region would be somewhere over here. This is the left parasternal 2nd intercostal space. And finally, we had our aortic valve, which was located somewhere over here. And the aortic valve opens up into the aorta, which is going in this direction. So somewhere over here, we have the aortic area, which is in the right parasternal 2nd intercostal space. So these are the 4 auscultatory sites during a cardiovascular examination. We start with the mitral area, then the tricuspid area, then the pulmonary area, and then the aortic area. Now remember, murmurs can be either because of a regurgitation or a stenosis. So again, mitral regurgitation and mitral stenosis murmurs best heard here. Tricuspid regurgitation, tricuspid stenosis best heard here. Pulmonary stenosis and pulmonary regurgitation best heard here. And aortic stenosis is heard best here. However, aortic regurgitation is heard somewhere best over here. This is the Erb's point. This is the left parasternal third intercostal space, and you can hear the murmur of aortic regurgitation the best over here. Now let's talk about the murmurs in a bit more detail. We said that when we're auscultating the mitral region, we're going to be able to hear the murmur of mitral regurgitation. This is backward flow of blood through the mitral valve. It would produce a pansystolic murmur or a hollow systolic murmur. Pan means throughout, systolic means systole. So this murmur would span the entirety of systole. So systole begins with S1, we would hear a murmur right after that, and then systole ends with S2. So you can see that this murmur is occupying the entirety of systole. So therefore it's called a pansystolic murmur. Alright guys, now I'm going to play the sound of mitral regurgitation for you. Please insert your headphones in order to listen to this more clearly. Now, the turbulence in the flow of blood causes the sound to be transmitted in one more direction, and this would be towards the axilla. So when you're auscultating the mitral area and you pick up on a mitral regurgitation, be sure to auscultate the axilla as well for the radiation of this murmur. The next murmur we could pick up on in the mitral area would be mitral stenosis. This would produce a mid-diastolic rumble. What that means is mitral stenosis would produce a rumbling sound somewhere in the middle of diastole. So the space between S1 and S2 would be called systole. There would be no abnormalities during systole, but after S2 we would hear an opening snap, and that would be followed by this mid-diastolic rumble. Now, what is an opening snap? In mitral stenosis, the valve leaflets are unable to open as freely and completely as they would normally. This stiffening of the mitral valve produces an abnormal sound as the valves open. This abnormal sound is called an opening snap. So we know that S1 is produced by AV valve closure. We know S2 is produced by semilunar valve closure. As soon as the semilunar valves close, the AV valves open. Normally, the opening of AV valves don't produce a sound. However, if the AV valves are stenotic, as the blood flows through them, it will produce an abnormal opening sound called an opening snap. This would be followed by this mid-diastolic rumble. Now notice how in the middle of diastole, the sound of this murmur is the most intense, but as blood flow decreases through the mitral valve, the sound of the murmur decreases as well. And we know at the end of diastole, the atria contract to push a little bit more blood through the AV valves, and this causes an increase in the sound of this murmur called pre-systolic accentuation. Now I'm going to show you what mitral stenosis sounds like with your stethoscope. Please insert your headphones to listen to this carefully. The next murmur you can hope to hear would be in the tricuspid region. This would be tricuspid regurgitation, and this, like the mitral regurgitation, would be a pansystolic murmur. So it would last throughout systole, meaning it would begin at S1 and go all the way till S2. This murmur radiates to the right lower sternal border. Another murmur that you can hope to pick up while auscultating the tricuspid region would be tricuspid stenosis, and just like its counterpart, it would also be a mid-diastolic rumble, meaning you would clearly hear S1. There would be no abnormal sounds between S1 and S2. After S2, you would hear an opening snap followed by a mid-diastolic rumble. The tricuspid sounds are going to sound exactly like the mitral sounds, so I'm not going to play them for you. Moving on to the aortic area, the murmur you can hope to hear in the aortic area would be aortic stenosis. This would be a ejection systolic murmur, meaning as the blood is ejected from the heart during systole, you would hear the murmur. First, you would hear S1, which is the beginning of systole, and remember that when AV valves were stenosed, there was an additional sound called an opening snap. So you would also hear an opening snap in cases of semilunar valves. However, we do not call this an opening snap. It sounds more like a click. So since it occurs during systole, it is called an ejection systolic click. Now, as more and more blood flows through this stenosed aortic valve, you will hear a murmur that increases in intensity, and then as the pressure in the left ventricle begins to fall, the sound of the murmur will begin to decrease, which would be followed by the normal S2 sound. Now I'm going to play the murmur of aortic stenosis. Please insert your headphones to listen to this clearly. This rise and fall of the murmur is called a crescendo decrescendo murmur. Crescendo meaning point that slowly increases in intensity, and decrescendo means a point that decreases slowly in intensity. So at the start of systole, more and more blood is flowing through the aortic valve, which would cause the crescendo part of this murmur. And as the pressure in the left ventricle begins to fall, less blood flows through the aortic valve, which leads to the decrescendo part of this murmur. Again, murmurs can tend to radiate in the direction of flow of blood. So this murmur would radiate along the carotid arteries, which are branches of the aortic arch. Now, we mentioned that aortic regurgitation could be heard in the aortic area, but the best area to listen to aortic regurgitation would be the Erb's point. If you auscultate this region during aortic regurgitation, it would produce a early diastolic murmur. This means that there would be no abnormal sounds during systole, so you would hear your regular S1 then S2 with no abnormal sounds in the middle, but after S2 you would hear an abnormal sound during early diastole, which would be followed by S1, and then the cycle would repeat itself. Now I'm going to play the sound of aortic regurgitation for you. Please insert your headphones to listen to this carefully. Since this murmur is loudest at the start and begins to fall gradually, it's also called a decrescendo murmur. And like the other examples, sound is transmitted along the direction of flow of blood. So if blood is flowing backwards from the aorta, the murmurs would radiate along the left parasternal border. Now, the final area left for auscultation was the pulmonary area. In the pulmonary area, you can appreciate the murmur for pulmonary stenosis. This is again an ejection systolic murmur. As blood flows through this stenotic valve, it causes a clicking sound called the ejection systolic click, followed by a crescendo decrescendo murmur, and systole comes to an end at S2. And this murmur radiates to the left shoulder or the left clavicle. Again, this is along the direction of flow of blood. And the final murmur you can appreciate in the pulmonary region would be pulmonary regurgitation. This is an early diastolic murmur, meaning S1 would be followed by an S2 with no abnormal sound in the middle, but early on in diastole you would hear a murmur. This also is called a decrescendo murmur. Now, I know that this can get really confusing, especially for first and second years, but what I want you guys to focus on are the names of these murmurs. Now, oftentimes you guys are going to be given disease presentations that you might not be aware of, but the names of these murmurs will almost certainly be mentioned in the question stamps. And if you remember which murmurs belong to which category, you are likely to identify the structure that is at fault. Now, how can you get tested on these questions? Well, let's look at an example. A 44-year-old male presented to the ER with fever, palpitations, and shortness of breath since the past day. He had a dental procedure in the last week. His vitals are as follows. Temperature is at 104 degrees Fahrenheit, respiratory rate is 25, pulse is 120, blood pressure is 90/60. On general physical examination, he had red spots on his palms, and a cardiovascular examination revealed a pansystolic murmur in the left fifth intercostal space. What structure has most likely been affected that led to his symptoms? A. Myocardium, B. Tricuspid valve, C. Mitral valve, or D. Aortic valve. Now, the question gives you a pretty obvious example of infective endocarditis with a person experiencing fever and pretty typical symptoms of heart disease. Plus, the big giveaway was this dental procedure, which is a major risk factor for infective endocarditis. And then you have a pretty classic finding on general physical examination called Janeway lesions. These are red spots on the palms and soles of the feet. And the cardiovascular examination had a pansystolic murmur in the left fifth intercostal space. Now, notice how an understanding of infective endocarditis isn't really necessary for the question, because the question is asking you which structure has been affected. The easiest way to answer this question is to notice which region were they auscultating. They were auscultating the left fifth intercostal space. We auscultate this region when we're looking for mitral valve murmurs, and the word pansystolic murmur kind of gave it away. So this is a murmur of mitral regurgitation. So we can easily see from the physical examination findings that the answer would be a mitral valve. Guys, I understand that this topic can be really confusing. However, if we're talking about anatomy, generally what they like to do is link valvular structure with murmurs. So you are most likely to get to the right answer just by knowing the type of murmur plus the site of auscultation. I hope this video helped make sense of a lot of things for you guys. I try to get all this content into one easy slide so that it would be visually more easier to compare and contrast the different kinds of murmurs and different kinds of locations of heart valves plus the auscultatory regions. If you enjoyed this video, do like, share, and subscribe to my channel. Hit that bell icon to stay notified about the newest videos coming out. And as always, I hope to see you in the next one.